Hi, hello. I am Dr. Krishan from Teaching Hospital, Badulla, Sri Lanka. We are talking regarding this sexual problems occurring in males. So today we are going to discuss about this erectile dysfunction. So erectile dysfunction is defined as persistent inability to attain and maintain an erection sufficient to permit satisfactory sexual performance. It means a male cannot maintain a satisfied erection to have the sexual intercourse with his girlfriend or with his wife. And due to that, he got lot of problems. These problems causing his ill health. After that, he can't attain his normal routine work, or he can't go to normal office or school or whatever said and done, and he can't maintain a good normal sexual health. So it's very important, as I several times I told you earlier, in a human, not in only with the human, even the animal kingdom, three important points we have to maintain. First is food, second one is sleep, third one is sex. So we must have adequate sexual health or sexual intimacy or sexual ability to maintain our normal body health. So erectile dysfunction, due to this unable to maintain a persistent satisfactory erection, it may affect the one individual's physical and psychosocial. Very important. So normally some people early morning coming to office or whatever said, they go there and scolding other officers or scolding other staffs who is working under him. Why? Because previous night he had a proper sex with his wife or with his girlfriend. So it affects his physical as well as physical and psychosocial health. For the physical means we will take all sort of diseases, right? Heart attack or whatever, pressure, hypertension or diabetes mellitus, like that. As well as the psychosocial health is mentality, very, very important. To keep his mental health good, he has to have a very good sexual life, unless it affects everything. So then other problem is it may affect his quality of life. We are telling QOL, quality of life. What is the meaning of quality of life? You know, if you want to have an intimacy, very good sexual relationship with his wife or with his girlfriend, his quality of life is already get affected and he can't maintain a normal life, human life. So very, very important. As I told you earlier, food is important, sleep is important, third one is the sex is very, very important. So sexual life is so important for a man to maintain his normal psychosocial health as well as physical health. Due to this, his quality of life is both get affected. Physical health as well as the psychosocial health is affected. The quality of life is going down. For example, he is having a hypertension. He is having a diabetes. So he is having a chronic renal failure. Whatever said and done. If he is having this type of physical problem, his qualities of life is low, because he can't go for a normal exercises, he can't go for a normal function, or he can't go for a normal work duty. So that quality of life is affected due to his physical illness. Like that, his psychosocial, if he get affected due to the sexual problem with his wife or due to sexual problem with his girlfriend, what will happen is his psychosocial health is also get affected. Psycho health means you must be knowing mental health. Social health is very important. He can't maintain a good relationship with others in the society. So very, very important point. If his psychosocial health is get affected, his quality of life also going down. So very important, erectile dysfunction may affect our physical as well as psychosocial health. Inversely, it affects the social quality of life. So due to this, very important point, we must have a sufficient erection to have a proper sexual intercourse with our wife or with our girlfriend. Due to that, she gets, wife or girlfriend gets a full course of orgasm. Due to that, she will get the fully satisfaction. After that, we also, males also getting this all sort of orgasm. So very important point, the sexual health is very important. So we must understand what are the things going to happen if our erectile dysfunction is not erectile, if the erectile dysfunction happens. If we won't get a proper and persistent erectile function, we will get all sorts of problems. So what are the physiology of this penile erection? We have to see this. First one, the penis is there. Inside the penis, there are a lot of blood vessels. It's having a severe blood supply, large amount of blood supply. So when the penis is going to erect, there is a arterial dilatation. Arterial dilatation is very important. What is the meaning of artery and vein? You must be knowing. When heart is there, from the heart, some vessels are getting the blood from the heart to the organs. That is called the arteries. Other vessels are there. They are taking the blood from the organs to the heart. Those called veins. So here, inside the penis, there must be an arterial dilatation because it brings the blood from the heart to the penis. So there must be an arterial dilatation to get the enough amount of blood flow inside the penis. First. Second one, in the penis, there are arteries are there, veins are there. There is a trabecular smooth muscles. So when the muscles are constricted, when the muscles are contracted, there won't be no blood supply to any organ. Like that, when the penis want to get more blood supply, there is a trabecular smooth muscle dilatation is very important. So when we want to get a sufficient amount of erection, there is an arterial dilatation as well as trabecular smooth muscle relaxation. Anyway, so we'll finish on this point. So if you like this program, please share to others. If you are seeing in the YouTube, please like it, share it, as well as subscribe it. When you are following in the TikTok, please follow me. Thank you very much.